المنصب الكريم. دوني أبدأ.
تفضل.
وأوصيكم بالكومنتيشن. دكتور عماد صلاح أحمد حسن. He's a head of section, assistant professor, consultant, internist, pulmonary medicine. To give a brief about Prof. Imad, Dr. Imad Hassan is a highly qualified and experienced clinical and academic consultant physician with an outstanding track record in hospital-based patient care and academic training of clinical staff and undergraduates. His credentials include exceptional teaching and training skills, and by the way, chosen as best tutor 6 times, curricular development, implementation, and assessment in competency-based, outcome-focused medical education, scheme-based using cognitive aids education and critical thinking, problem-solving, and effective decision-making. Also, education, training, and implementation of effective evidence-based medicine, besides conduction of and monitoring of morning meeting, journal clubs, medical audit, and medical research, etc. He graduated from the University of Khartoum and has acquired his MD from the University of London, UK, in the year 2000. And is a fellow of the American College of Physicians and Royal College of Physicians of Ireland، وهو واحد من المؤسسين لمؤسسة الطبابة العريقة العظيمة، نحن بنسميه دائما the godfather of الطبابة. بروفيسور عماد حياك الله، ربنا يديك العافية. Your ground، تفضل مشكور.
مشكور يا دكتور تيسير. الحقيقة طبعا الناس they might actually say question why am I into evidence-based medicine and patient safety. الحقيقة أنا for more than 10 years أنا كنت المسؤول على knowledge translation أو implementation of evidence في مستشفى الحرس الوطني بالرياض في Department of Medicine. فالواحد gained a lot of experience in implementing evidence-based practice. فأنا أبدأ البرزنتيشن بتاعتي and I hope I'm sure you will find it very useful and it will highlight many of the issues اللي هو Dr. Haytham already has highlighted. طيب obviously we are commemorating the World Patient Safety Day, 17th of September, an international day. Right. Now the roadmap of my presentation will be, one, I'll be talking about the place of patient safety in healthcare reform and modernization, obviously with relevance to Sudan. The second part I'll be highlighting is the impact of poor patient safety on the healthcare system and the country as a whole. The third component is the status of patient safety in Sudan healthcare system. I've just chosen only one slide to show that. Dr. Haytham already has highlighted that deficiency. And the fourth, or the most important part is how to transform healthcare to a safer system in Sudan. So the first part is, where does patient safety come in transforming or modernizing healthcare system in Sudan? Right. So in that sense, I have to enumerate the strategies that will fix healthcare. Yani, what are the strategies that might help modernize and reform healthcare in Sudan? If you look at the literature, there are at least 7 strategies الآن المفروض الناس all over the world, يعني people all over the world should be utilizing to modernize and reform their healthcare systems. The first one is obviously evidence-based healthcare, and which is about actually making sure that whatever interventions we use in healthcare are evidence-based. The second and important strategy is patient and family-centered care, which is important in improving outcomes. The third, obviously, is the patient safety, which we'll be talking about a bit more today. The fourth is competency-based medical education. Now, this is just like the others, is another important paradigm shift or important concept, and it's all about actually making your healthcare providers highly competent, able to fulfill their jobs to a high level. The fifth actually is called system thinking, and this is all about having a holistic view of the system and improving the system in all its aspects, in its structure, in its process, and its outcome. And I will actually highlight this in how safety improvement efforts should be based on system thinking. The sixth element is value-based healthcare. Now, all over the world now, people are moving to value-based healthcare, which is about actually making the healthcare provider accountable for the cost and outcome of their healthcare. And this is a move pioneered in the States, and is taking place all over the world. And the seventh element is obviously using technology to get to to achieve the goals that you wish to achieve. Now, these are all these elements, the 7 elements, are actually called paradigm shifts. These are paradigm shifts in a sense that they represent a significant change from the usual way of thinking of doing things. In themselves, they are actually considered to be a revolution or a transformation. Patient safety movement is a paradigm shift in itself because it has changed the way healthcare is, or modern healthcare is looked at, right? Patient safety is about bridging the gap between practice and quality, and obviously quality has safety in its center, right? Now, what are the risks or the dangers of having poor safety practices? Now, there are risks to patient, risks to staff, and risks to the government and healthcare system as a whole. So what are the risks to the patients? If you look at the harm that patients can actually be afflicted with in several industries, if you look at nuclear power or European railways or scheduled airlines, you find that the chances or risk of harm is less than 1 in 100,000 encounter. Well, if you actually go to healthcare, you find that the risk is more than 1 death per 1,000 encounter. So the risk of actually being harmed in healthcare is more than 100 times more than actually in these, what we call the high reliability organizations. These are where safety is paramount, right? Where the possibility of harm to staff and to customers the possibility of harm is so low. And as a matter of fact, if you look at harm in healthcare, if a patient actually goes into hospital, the risk of being harmed is equivalent to somebody actually climbing a mountain or practicing bungee jumping. So the risk of actually going to hospital is as bad as somebody climbing a mountain, and this is actually extremely huge, right? Quantitatively, this comes as a 10% of patients being hospital, being harmed. And in primary practice or outpatients, it can go up to 40%, or 4 out of every 10 patients. Now, in essence, healthcare is the only industry that harms 10% of its customers. And this is an unbelievably high number, right? And it's important to note that harm do not accidentally happen, it is caused. So as it is caused, it can be prevented. Now, if you look at the situation in Sudan, and this is a publication from 2012, and they looked at achievements of critical standards across domains of patient safety, like safe environment, evidence-based clinical practice, patient and public involvement, leadership and management. And unfortunately, you see that Sudan is at the bottom of the list. Egypt, Jordan, Morocco, Pakistan, and even Tunisia are all ahead of us in patient safety measures and policies. Right. So what's the risk to healthcare providers? Right. The risk to healthcare provider is high. It is actually also quantifiable. The effects or impact is that poor safety standards or poor safety practices lead to long working hours, which is effect on stress, burnout, high staff turnover, and even suicide. Obviously, poor safety practices lead to increased infection rate or nosocomial or occupational infections or hazards like TB and HIV. And it also leads to poor service quality and patient harm, which is impact on low self-esteem, poor career progress, litigation, obviously, loss of reputation, fines, and loss of license, right? So the impact is serious actually for the healthcare providers. As a matter of fact, this has brought a new issue to healthcare. This is called the second victim phenomenon. Obviously, a patient that's harmed is the first victim. Patient and family are the first victim, and the doctor is the second victim, or the healthcare provider is the second victim. And that has brought up another domain in the patient safety movement, is having a program to deal not only with the family and the patient who've actually been harmed, but also with the healthcare providers. And this is an important component of any safety improvement program in any hospital. Now, an interesting thing, you know, in one of the, actually the Times magazine cover story, they asked doctors, what scares you? And they were asked, are you scared? You know, the answers came as, some said we are scared of patients because of litigation. Some said we are scared of colleagues because they can tell about our bad incidents or bad behavior. And some said we are actually afraid of administration because obviously they can actually sack them. But the interesting finding was that many doctors said that we are afraid of being patients. And the reason they've said that is because they know that they can easily get harmed if they are admitted to hospital or become patients. And as I said, this has come in 2006. It's one of the Times magazine cover stories. Now, the third element is actually a risk to healthcare finance and the country's economy as a whole. The unfortunate thing is that poor patient safety practices in hospitals, you know, can actually consume 20 to 40% of health spending. So this is an unbelievable waste, and this is something which Dr. Haytham has mentioned as well. And you see, in Sudan, at least 20% of healthcare expenditure is actually wasted, right? So an unbelievable amount of money in a country which is poor. So these are the three major impacts or effects of poor patient safety. That's patient cost, healthcare provider cost, and healthcare financial cost. Right, and the importance of patient safety is so enormous because they erode into the two important precious resources, and these are the human and material resources in any country, right? So we should not at all take patient safety as a simple measure. It's actually a strategic undertaking. You know, no healthcare provider can do without a strategic plan for patient safety, right? Why is healthcare unsafe sometimes? There are two primary reasons. These are system failures because of lack of policies and procedures and so forth, but also cognitive failures because of lack of knowledge and skills. It's well known that you have to collectively work on both the system and the cognitive failures to improve your patient safety. And the cognitive failures, obviously, you can improve them by actually good training and monitoring of staff. And that's where competency-based training comes in, right? We make mistakes all the time as human beings and as healthcare providers because of so many factors like fatigue, noise, many sick patients, phone calls, uncertainty, full bladder, home stress, new trainees, multitasking, hunger, violence. You know, the number of things that can impair our cognitive abilities and make us make mistakes and harm our patients are innumerable. There are loads of them. Right. Now, safety is about zero harm. Right. Zero harm is not only about patients and their families, it's also about the workforce. So it's very important to look at safety as not only for patients, but also for the workforce. So this is a very important concept, right? Safety is considered a cheap and effective insurance policy, right? You know, having patient safety interventions is an exceptional insurance policy. It's a very cheap insurance policy. The many factors actually, there are many factors which are you know, many ways of implementing a patient safety program, but I think the most important two are having the right vision and having the right leadership. So without the right vision and the right leadership, we're unlikely to achieve patient safety. And obviously, you need to have other factors like just culture, behavioral expectations, trust, and so forth. And I'll mention some of these later on as well, right? Now, a very important part of my talk is actually how to make the healthcare system safer. Now, there are two concepts or doctrines by which actually leaders in patient safety leaders may use actually to improve or implement a patient safety program. Dr. Haytham actually mentioned that they have actually managed to have loads of protocols and policies and monitoring parameters, but they are having a problem in actually implementing them. And this is a general issue all over the healthcare, industries in all over the world. So how shall we successfully implement patient safety interventions? The two doctrines are one, or methodologies used are, one is safety by design approach, and the other one is redesign for safety. These are complementary approaches. Now, as we are talking about the healthcare system, so I have to talk about this system. So what do we mean by a system, right? System thinking is a tool by which a holistic approach to solving problems in systems, or like in healthcare, should be approached. It's a holistic methodology to improve your system as a whole. Instead of actually working in small patches here and there in your system, right, you actually have a holistic view and work in the whole system to improve it, right? An important concept in system or systems thinking is that every system has three basic parts or anatomy: the structure, the process, and the outcome. The structure is how the service or business is organized. The process, how is the service delivered? And the outcomes, how is the service assessed? In healthcare system, we have these three components. The structure of a healthcare system has staff, like staff and departments and equipment, supplies, and environment. And as Dr. Hassan has mentioned, environment is an important part of the structure. The process, how things are done, so the pathways, the protocols, the orders, how people run the service, right? How is the service run? Even by housekeeping and transport. The outcomes in healthcare, we have six Ds, or the outcomes we measure. We measure disease, death and disease, disability, discomfort, dissatisfaction, and destitution of cost. Now, these are the 6 Ds. So whenever I'm actually wanting to implement a program for patient safety, I should look at all the 3 elements: the structure, the process, and the outcome. I want to improve the outcome. I cannot do it without improving the structure and without improving the process. Now, the first domain or method for actually improving patient safety is actually called safe by design. Safe by design means that, or safety by design means that I am integrating the safety measures early in the design process. Just like when an aeroplane is built. When an aeroplane is built or a nuclear plant is built, it's built with safety measures in mind. So it's actually built to be safe from scratch. It is safe to start with from scratch. And this is safety by design. A simple thing is, I actually have seen an emergency room being built in one of the big hospitals. The very sad thing is that there was hardly any sinks where people, or basins or wash basins where people could wash. So they have not actually built it with hand hygiene and infection control measures in mind. So there was not enough safety sinks, not enough wash basins or sinks where people could wash their hands. So the environment itself, for example, they going from one room to the other, there was a step, right? So they did not see that, they are actually pushing patients on wheelchairs or trolleys. There shouldn't be a step. It's unsafe to carry a patient up and risk that the patient will fall off a couch or off a wheelchair, right? So safe by design means you have to integrate the safety measures in your design process from the beginning. You want to minimize the risk to health and safety throughout the life of the structure being designed. So an aeroplane is actually built with safety in mind. So this is called safety by design. So modern healthcare facilities, right, they should be built to be safe. They are safe by design. So, and this is what's called safety is a system trait. It is a character of the system, right? It's not about changing the human condition, but rather the conditions under which humans work. So this is exactly what safety by design is about, right? And this, of course, brings another thing, which is called design thinking, because in design thinking, you bring all the stakeholders, even the patients, the nurses, the doctors, the porters, everybody, and you include them in actually designing the system that is safe and patient friendly, right? So you need an important concept to use whenever you are designing a safe system. The second way of actually improving a system, instead of actually safety by design, is you redesign your system to be safe. Right. Now, system redesign is a new concept in healthcare reform, right? It's been there for several years, but it's all about redesigning your service, all of it. You change the structure and you change the process to achieve the outcome that you want. So you are aligning or realigning a faulty system to improve the outcome. The whole structure or process is redesigned to an ideal structure or process. It's based on evidence. For example, I want to have a safe pharmacy, a safe prescription of medications. So I have to redesign the whole structure and process of prescribing my medications until it gets to the patient and delivered to the patient. So the whole structure and process are redesigned, right? And it's been seen that actually, if you redesign your process, you can eliminate up to 90% or more of the adverse events you have, right? And there are so many ways of redesigning your structures and processes, right? You can redesign the physical structure and environment. So the environment should be clean and safe for the doctors and for the nurses and for pharmacists, for everybody. You can actually change the structure by having new divisions, like knowledge translation division, a division which actually implements evidence, right? You can have a new team like a sepsis team or a trauma team or antibiotic stewardship team. You can have a continuous by the patient monitoring services, right? And so that monitoring is an important aspect of any improvement program. If there is no monitoring, everything falls apart, right? And this is part, continuous monitoring services. This is part of high reliability organization. This is an important aspect of why high reliability organizations have very low harm. You can change the process by having a hospitalist service. You can redesign the training programs so that you train your staff on the competencies of patient safety, right? And you can include patient decision support systems. You can have standardization. Another important concept or tool that high reliability organizations use to standardize their care. They use electronic orders, pathways, protocols, or checklists and reminders to standardize care. And obviously, instead of looking only at patient mortality and morbidity, it's very important in modern healthcare services to look at patient satisfaction and staff satisfaction. These are important outcomes that come along with the new with service redesign. Right, this is all about physical environment redesign. Even the surfaces, you can use surfaces to reduce patient falls, or you can use surfaces without using toxic materials, or surfaces with antimicrobial characteristics, right, to make sure that you have good infection control. There are three important elements. Whenever you are redesigning your service, you have to incorporate them, right? One of them is called, the important one of them is the essential hospital safety bundles and interventions. The other one is organizational culture, and the third one is high reliability organization principles, right? In the literature, there are at least 55 essential hospital safety bundles and interventions, a very big list, and every hospital should have these 58 essential hospital safety bundles and interventions incorporated, right? The second part is you use the important concepts or tools that high reliability organizations use. These are the organizations with very low harm to customers and to staff, like nuclear power station or airline industries. And what they are doing is they have everything is standardized and protocolized, right? Nothing is done, whether it's healthcare, medical care, or pharmacy, or transfer or transport, everything is standardized. Nothing is left to the guesswork of the individual. They have by the patient continuous monitoring, right? The monitoring is not at the end of the month or 3 months you do an audit. No, they monitor the patient on a daily basis. You know, how are the medications prescribed? You monitor them. How is it done, right? Hand hygiene. They monitor doctors and nurses on a daily basis, right? The nurses actually check on the doctors check on the nurses, right? The nurses, if they see the doctors don't actually doing hand hygiene, they actually report them as part of the safety culture. And the third important thing, what high reliability organizations do, is that they are always on the look for latent error detection, for latent errors. So they detect latent error before it causes any harm. So the first one is having the right bundles and interventions, the 58 ones. The second one is using the tools and methods that high reliability organizations use. And the third and very important element, and you know, one was actually very pleased to see that you know, this is also being taken into consideration in the safety improvement movement in Sudan, patient safety improvement, and this is about organizational culture or safety culture. Without having this in mind, without having a safety culture in mind, right, it's unlikely to work. In the hospital where I work, our organizational culture is safety. So we are all obsessed by safety. It's without that in our mind, we don't actually, we would not have a safety practice, right? With safety culture, obviously comes the just culture. The just culture means that we balance safety and accountability. People who do exceptionally well in safety, they are rewarded. People who have harm a patient because of error, they are given support. They have at-risk behavior, they are trained and coached. If they have reckless behavior, they are disciplined. So this is all about the just culture, an important concept in any organizational culture of safety. Right. Safety is a collective effort. It's not done by one team at the Federal Ministry of Health, right? It's actually a collective effort and everybody is responsible. You know, all people working in the hospital and even patients and their relatives and the family should be involved in the patient safety. So in summary, patient safety is a strategic lever and a paradigm shift for healthcare reform and modernization. Poor patient safety practices result in significant human and financial costs. Sudan patient safety profile is still unacceptable and calls for a transformative action. The two tools that leaders in healthcare should use to improve patient safety practices and obviously reduce the 20% wastage of resources is safety by design and system redesign.
That formula doesn't work. Try saying it.
Right. So with this, I thank all the audience, and I hope I have answered some of the questions about patient safety and gave a bit of guidance on how to improve our safety practice. Thank you very much. And if there are